Well, good morning. It's time for Healthy Communities. I've got a very special guest in this morning. It's Dr. Westgate. How are you this morning?
I am very well, thank you, Bob. And how are you?
I'm just fine. Thanks for getting up so early. My goodness, you must have got up 2 hours earlier and just made yourself up. You were coming to radio. You didn't? Are you going to another appointment after this? You
Yes,
have to be
I
a
am.
doctor?
Okay, exactly.
That's
yes.
you're in your doctor wear. Well, you look quite nice this morning.
Thank you.
So you're an OBGYN.
Yes, I am.
We're going to talk about babies.
How exciting.
It's very exciting. It's new life.
Very new life.
See, so this is a good subject. Well, let's say you're thinking about getting pregnant. How should you prepare to get your body ready to be pregnant?
That is a very good question. Bob, did you know that the majority of pregnancies in the U.S. are actually not planned?
I would guess.
Right. So for those of you women who are planning this, it's very important that you actually make an appointment to see your doctor or healthcare profession before you start getting pregnant. There's quite a few things that we can do for you to ensure that you have a happy and healthy pregnancy, and it actually starts before you're pregnant. The first thing that we would do would be to check the medications that you're on and make sure that they are safe to take during pregnancy. And we would actually start you on some medications ourselves. This would include a prenatal vitamin that contains folic acid, or folate. That's another name for it. And that's very important for the prevention of neural tube defects in the baby as it's forming. The neural tube, an important fact, mainly starts the formation before you even know that you're pregnant. So to ensure that it forms correctly, you need that folate or folic acid before you get pregnant. We also want to make sure that you're free from any kind of infections and treat you for those before you would get pregnant to make sure nothing would harm the unborn baby. And then we'd want to identify any hereditary or genetic disorders that run in your family or the father of the baby's family, so that we can counsel you accordingly.
And keep an eye on it if something
Exactly.
Okay.
And then the other thing we'd like to do is, if you did have a medical condition, for example, high blood pressure or diabetes, we would like to manage that optimally before getting pregnant to ensure that the pregnancy, even though it would then be high risk, but it would be on the lower end of high risk because you're coming in from a good, healthy standpoint.
Right. You've already got your eye on it. So what should you do, like, as far as your lifestyle? Like, change, like if you're drinking, you got to quit drinking, right?
Correct.
Obviously,
you do.
no smoking.
Correct. No smoking and no illicit drugs or recreational drugs.
Oh, no recreational drugs.
No,
well, this
sir.
is probably a minimal good idea.
Good. I'm sure most women will say, well, what about in Europe? Women drink wine with
Yeah, what
meals.
about that? I've heard both
Right,
sides. Like some
exactly.
women in Europe say, I can have a glass of wine.
Right.
It doesn't affect the baby. What do you think as a doctor?
As a doctor and as a future mom one day, I would never want to do anything that would potentially have the risk of harming my unborn child. So the issue is that we don't have any randomized trials that say, okay, you're going to drink 3 drinks, this group of women. You're going to drink 5 drinks, this group of women. And then we're going to see which babies come out with fetal alcohol syndrome. No woman is going to agree to that kind of study.
That's
exactly.
not a good trial.
Not a
No.
good trial at all. So we don't have good evidence to say 1 glass is fine, but 5 glasses are bad. So what we recommend is just abstain for 9 months.
This probably is a good idea.
Right.
I think I would agree on that one. So what foods are like good foods to eat that make you, healthy for the baby? You're eating for 2.
That is correct and incorrect.
You're eating for 1, but okay. Well,
yes.
break it down for us.
Okay, so your statement of you're eating for 2 is not quite correct anymore. We know now that excessive weight gain in pregnancy is actually harmful to you and to the baby, increases your risk for gestational diabetes, C-section, preeclampsia. So it increases your risk for pregnancy complications, so we don't recommend it.
Okay.
You only need an additional 300 calories a day when
That's
you're
it?
pregnant. That's it.
It's not even a bowl of chowder.
Exactly. However, when you're breastfeeding, you actually need 500 calories a day additional.
Okay.
So you get to splurge a little bit more when you're
After
breastfeeding.
the baby's born,
Exactly,
then
and
you
you're
get to-
breastfeeding. Very good.
Okay.
So what are healthy foods to eat? We encourage lots of fruits and vegetables. That's a great way of getting natural minerals and vitamins. Whole grains. Food that's low in sugar, obviously no refined sugars, milkshakes, candy bars, diet sodas, or regular sodas. We don't recommend that.
Bad sugar.
Right, exactly, and fake sugar. Dairy products are great for their calcium value, and then your lean protein, so that you're getting a good source of protein but not the additional calories.
Mm-hmm. How about your exercise program? Because everybody should exercise long before the baby.
Exactly.
So can you keep exercising while you're pregnant?
You most definitely can. And even if you don't exercise, now would be a great time to start. You can even start an exercise program in pregnancy. However, I would recommend that you would speak with your doctor first so you can come up with a healthy exercise program plan. For those of you who are already avid exercisers, the intensity of exercising that you're used to, you can continue that through your pregnancy. However, as your belly starts to get bigger, especially in your third trimester, comes a lot of aches and pains and backache, so you just may not be able to continue at that intensity. The kind of exercises that we do recommend would be walking and swimming.
Should always walk.
Exactly. The one exercise that we most definitely do not recommend would be scuba diving. So that's the definite no-no.
That would be pressure on the baby.
Exactly.
Yeah, pressure on your ear is pressure on the baby.
Right. So that's a definite no-no. A lot of women have asked about, well, what about horseback riding? What about tennis? What about racquetball? I do aerobics. So the advice that I give to women in that case is if you're going to be playing a sport that has the potential for contact and getting hit in the belly, that is dangerous to the baby.
Yeah.
And so we do not recommend that.
In horseback riding, you could induce
you
labor
can fall
or something.
off,
or
right.
you could fall off and you
fall
fall on the baby.
So that would be the concern. So once you're out of your first trimester and the uterus is now not protected by your pelvic bones anymore, then we recommend that you change your form of exercise to
just swim.
It's
a perfect exercise.
Right. Aerobic activity, dancing, all of that kind of stuff is fine. We just don't want contact sport or any kind of sport where you could fall and directly impact.
No contact with the baby. But right till the last day, you can keep exercising?
Yes, sir.
So
the
that's
last
good.
Day. It's actually been shown to improve the baby's heart rate and its ability to tolerate labor if you have a woman who has exercised throughout her pregnancy. And it will help mom during the difficult portion of pushing, during the labor portion. So,
so it's good to work out.
Very,
it's going to
very
help
good.
later on.
Good. And think about all of the wonderful effects that exercise has on decreasing anxiety, helping with depression, sleeping, exactly.
Anxiety.
Yep. All that endorphin release that you get to make you feel
There's
good.
your natural high, since you have to get off of
your
everything.
Drugs, yep.
Right? There's your natural drug,
exactly.
endorphins.
Very good. Very good.
So where can people find you?
I am actually located in 3 different places. The first location is our main office, and that's the St. Helena Women's Center, and that's right in St. Helena, right off of 29 in the Inglewood Business Campus. The second place is right here in Napa Valley, and that's off of Trunkus Street, and the third place is in Hidden Valley Lake.
Ooh, all 3 lovely places. I see you've chosen to work in beautiful places.
I certainly have.
Nice choice.
Yes, thank you.
And how can they find you online?
The place to go is St. Helena Hospitals, that's with an S at the end, .org.
stHelenaHospitals.org. And we've been talking with Dr. Westgate. What a pleasure. Thank you
so
much
for having me, Bob.
Oh, thank you.